Now we're going to go on to the instructional portion of how to use the AED. The AED stands for Automated External Defibrillator. There are different types of AEDs out there, so it's very important that you familiarize yourself with the AED that you're going to use. The universal steps for the AED are as follows. Turn on the AED. Some AEDs you may have to open up the carrying case to power it on. Other AEDs you may actually have to push a button to power it on. After you power on your AED, then you're going to follow the prompts. Listen to the AED. The AED is going to tell you exactly what to do. Some AEDs may have pictures to indicate exactly what to do. Most AEDs should already be equipped with a razor and another set of pads. Before you apply the pads onto the patient, you have to think of these few considerations. If the person is wet, you want to quickly wipe off the chest because the pads may not stick if they happen to be wet. If the person has a hairy chest, go ahead and shave that individual to remove any hair that you're going to apply the pads on. If the person happens to have a medicine patch, you want to peel off the medicine patch. Remember to always use your gloves because that medicine can travel through your skin. So pull off the medicine patch and go ahead and wipe it off. If the person happens to have an implanted pacemaker or some type of shunt or anything that's below the right clavicle, you can still use the AED. Remember, if the pacemaker is not working, that internal defibrillator, that means you need to use that AED. So even if the person happens to have a pacemaker or an internal defibrillator, remember it's malfunctioning, which is why they're in cardiac arrest. So yes, you absolutely would use the automated external defibrillator, the AED, but you'll put it below. As you can see, the pads, they have pictures. And with these pictures, it shows you exactly the direction on where to put on the AED. So we're going to go ahead and turn on the AED. We want to remove the pads. And as you can see, right over here, it shows you on that patient's right. That patient's upper right, and then you're going to put it on their lower left. You will peel off the sticky backing and apply it directly to the upper right and lower left of the patient. After you turn on the AED, you apply your pads, you listen to the prompts, and then you wait for the shock.